Welcome to Project First Line, Infection Control Concepts and Actions for Healthcare Settings, Cleaning, Disinfection, and Sterilization. In this presentation, we'll be reviewing germs in the healthcare environment, cleaning, disinfection, and sterilization, waste management, and sterile processing. We'll then finish with key takeaways. Let's start off by looking at some facts. Every day, patients get infections in healthcare facilities while they are being treated for something else. This is due to the time in the hospital that puts patients at risk for a healthcare-associated infection, also called an HAI. Each day, approximately 1 in 31 U.S. patients and 1 in 43 nursing home residents contracts at least one infection associated with their healthcare. Because some patients and residents have weakened immune systems, they are at higher risk for getting sick with an HAI. The germs that cause HAIs can live on dry surfaces for days or even weeks. Healthcare workers then come into contact with these germs and spread it to others and the surrounding environment. In fact, 30 to 40% of HAIs are caused by the contamination of healthcare worker hands. This is why environmental cleaning and disinfection are important in the healthcare setting. Environmental cleaning is a fundamental intervention for infection control. As we begin today's conversation on germs in the environment, let's take a moment for a discussion question. With the healthcare setting in mind, where are germs found in your work environment? Let's take a moment to pause and think of some answers. Continue when you're ready. When we think about germs spreading in healthcare, we think about reservoirs. Reservoirs are the places where germs live on and in the human body and in the environment. Germs can be found in other reservoirs like in food, but this training series focuses on these core categories when we look for risks for germs to spread in healthcare. Here are the 8 reservoirs where germs live in healthcare. In the human body, we have skin, the gastrointestinal system or gut, the respiratory system, and blood. In the healthcare environment, we have water and wet surfaces, dry surfaces, dirt and dust, and devices. When you understand where germs are found and how they can be moved to places where they can cause harm, you can recognize when they can spread and decide what you can do to protect yourself, colleagues, and patients or residents. Germs can be found in other places, but these 8 are central to understanding and recognizing the risk for infections to spread in the healthcare setting. The world is covered in germs, especially in healthcare. When we think about where germs live in the healthcare environment and the steps we can take to keep germs from spreading, we think of the 4 core reservoirs: water and wet surfaces, dry surfaces, dirt and dust, and devices. On this slide, you will find some of those reservoirs that we commonly find in the healthcare environment. Listed here are just a few germs that are commonly found on these different surfaces. Some germs are resilient and can survive on surfaces for a very long time. For example, C. diff spores have a protective coating allowing them to survive for months or sometimes years on dry surfaces. Rotavirus, which is a very contagious virus that causes diarrhea, can survive for approximately 2 months. Viruses from the respiratory tract, such as influenza, rhinovirus, and SARS, can survive on surfaces for a few days. It's easy for healthcare workers and patients to come into contact with these harmful germs. Regular cleaning and disinfection of frequently touched surfaces are essential to minimize the spread and maintain a hygienic environment. These germs can be harmful to healthcare workers and patients, which is why environmental cleaning is so important, so we can remove these harmful germs and minimize the risk of infection. In most cases, there are four main pathways for germs to spread from reservoirs in healthcare. The first is through touch. That usually involves the skin, especially the hands, but it also happens with devices, which touch different people and many surfaces. Another pathway for germs is through breathing in. A third is through splashes or sprays of blood, body fluid, or water from a sink or other source. Germs in those splashes or sprays can get into a person's eyes, nose, or mouth, or into a cut or a break in their skin and cause infection. The last common pathway for germ spread in healthcare is through clinical care tasks that bypass or break down the body's natural defenses, like when a patient's skin has to be broken to insert an IV. That creates a pathway for germs to enter the patient's body. Knowing where germs live and how they spread helps you to recognize risk. To make decisions about infection control, it's important to think about where the germs are. That would be the reservoir or reservoirs that you're dealing with, and how the germs might get somewhere else, the pathway. Then you can recognize the risk for germ spread to happen and do something about it. When we think about where germs live in the healthcare environment, we think of reservoirs, such as wet and dry surfaces, devices, and items. These aren't the only places where you can find germs, but we focus on them because they have high numbers of germs and levels of contamination. There are three types of surfaces that are important reservoirs for germs. They are shared medical equipment, dedicated medical equipment, and high-touch surfaces. We'll begin with the first column. Shared medical equipment includes items that are used by many workers and patients throughout the day. Some examples include the vital signs cart and wheelchairs. These items should be cleaned after each patient use, which is usually done by nursing personnel. Next, we have dedicated medical equipment. These items are used by one patient, often, and for long periods of time. Examples include beds, bed rails, bed linen, IV poles, and bedside tables. Because these items are in close and prolonged contact with a patient, they can be highly contaminated and should be cleaned daily. Next, we have high-touch surfaces. High-touch surfaces include areas and objects that are frequently touched by healthcare workers, patients, and visitors. This can include doorknobs, sink faucets, toilet flush handles, bed rails, call buttons, and tables, just to list a few. High-touch surfaces should be cleaned daily. It's important to understand that surfaces and items contain many germs that can easily spread throughout the environment. Let's move on to an exercise so we can take a closer look at these different surfaces that we encounter every day. We'll now work together to find and discuss some examples of high-touch surfaces or items. Remember, high-touch surfaces are typically touched multiple times by multiple people. Take a look at this image and identify the surfaces or items that are frequently touched. Pause the video here to give yourself some time to come up with some answers before continuing. We've highlighted some of the high-touch surfaces so you can see just how easy it is for germs to spread. In this image, we can assume that the hospital worker touched the door handle when stepping into the patient's room. Once inside, she touched the tabletop, the vital signs machine, monitor, the IV pole, and the bed rail. She then touched the sink handles to wash her hands before leaving the room. In total, she's touched at least 7 different surfaces in just a matter of seconds. This image shows us just how easy it is to spread germs by touching different surfaces, and why it is so important to clean and disinfect them appropriately. Now that we've discussed where we find germs in our environment, let's talk about how we get rid of them through cleaning, disinfection, and sterilization. Let's take a moment for another discussion question. In your own words, what is the difference between cleaning, disinfection, and sterilization? Take some time here to come up with your answers, and then continue when you're ready. Now that we have a better understanding of where germs can be found, let's talk about cleaning, disinfection, and sterilization. We'll begin with cleaning. The goal of a cleaning is to remove visible dirt, dust, grime, smears, and spills from surfaces and items. When we clean, we remove some germs, but not all, with the use of water with detergent or enzymatic products. Cleaning is a critical step that must be performed before disinfection or sterilization. Next, we have disinfection. Through the use of chemical disinfectants, disinfection kills most germs on surfaces and objects. It's important to note that disinfection does not necessarily clean dirty surfaces and should not substitute cleaning. Next is sterilization. Sterilization completely eliminates all microorganisms, but requires specialized equipment and processes to achieve. A sterile processing department manages the sterilization process, but if the service is not offered in-house, the service is handled then by a third party. Disinfection and sterilization are essential for ensuring that medical and surgical equipments do not transmit infectious pathogens to patients. Because sterilization of all patient care items is not necessary, healthcare policies must identify, primarily on the basis of the item's intended use, whether cleaning, disinfection, or sterilization is indicated. Let's move on and take a closer look at these categories. What does cleaning look like? Cleaning in the healthcare environment is different than cleaning other locations, such as your home or an office. And that is because the healthcare environment often has bad, harmful germs that are very difficult to kill. The purpose of cleaning is to remove dirt and organic matter from surfaces using soap, detergents, or enzymatic cleaners. We must clean visibly dirty surfaces as well as high-touch surfaces. Cleaning is the first and most critical step before moving on to disinfection and sterilization. If a surface or item is not cleaned properly, or if left visibly dirty, disinfection and sterilization are ineffective, creating an opportunity for harmful germs to remain on the surface or item. If we look closely at the image, we can see a tabletop that has blood on it. You can judge just by looking at the tabletop that it's dirty and needs to be cleaned. We first clean surfaces that have dirt or organic matter, such as blood, before we can move on to the next step, which is disinfection. Cleaning supplies and equipment. To clean in an efficient and effective manner, we need to use the appropriate cleaning supplies and equipment, which includes personal protective equipment, such as gloves, gowns, mask, or eye protection, facility-approved cleaning products that include detergents and enzymatic cleaners, and EPA-registered disinfectants. Surface cleaning cloths, which can be cotton, microfiber, or disposables. You can also substitute these cloths for disinfectant or detergent disinfectant wipes unless you're cleaning spills of blood or body fluids. We'll go into more detail about this later. Cleaning cloths can also be used to wet dust. To wet dust, use a facility-approved cleaning product and apply it to the cloth to ensure that dust sticks to the cloth itself. Once we have our supplies and equipment ready, let's look at how surfaces should be cleaned. Surface cleaning workflow. It's important for us to follow a cleaning workflow when cleaning and disinfecting surfaces because it ensures that we are efficiently and effectively removing germs from surfaces in a safe manner. We achieve this by moving from cleaner to dirtier areas to avoid spreading dirt and germs to other surfaces. Then, we proceed from high to low, or top to bottom, to make sure that dirt and germs do not drip or fall from elevated surfaces to the already clean areas that are below. Last, we make sure to clean in a systematic manner, which simply means working left to right or right to left and keeping in that direction. Following these workflow principles provides a methodical approach to cleaning, which helps reduce the risk of cross-contamination. Surface cleaning process. Now that we have an understanding of the workflow principles, let's look at the surface cleaning process. First, start by thoroughly wetting or soaking a fresh cleaning cloth with the environmental cleaning solution. Next, it's recommended that you use the fold method to maximize all sides of a cleaning cloth. This is done by folding the cloth in half, then half again to create 8 sides. Remember to wipe surfaces using the cleaning workflow principles we discussed on the previous slide. As you're cleaning, regularly rotate and unfold the cleaning cloth after you've cleaned each surface until all sides are used. Once all sides of the cloth have been used, or when it is no longer saturated with solution, dispose of the cleaning cloth or store it for reprocessing. This process should be repeated as necessary. General workflow technique. To protect yourself and to prevent germs from spreading to the surrounding environment, we follow the steps listed here. Always make sure that you've cleaned your hands thoroughly before putting on gloves. Trash and soiled linen are reservoirs for germs that can easily spread. Remove these items first before you start cleaning and disinfecting. After handling trash and soiled items, remove and throw away your used gloves. Then clean your hands. Put on a new pair of gloves. With your new pair of gloves on, you can proceed to cleaning and disinfecting surfaces. When finished, look around the room to see if there are any issues that may need to be addressed. Last, remove your gloves and clean your hands. What does disinfection look like? As we look at the image on the screen, can we assume it's free of germs? The answer is no. While the room looks to be tidy and clean, we cannot assume that it's been properly disinfected just by looking at it. Remember, cleaning a surface only removes some germs from the surface or item. Disinfection kills most viruses and bacteria on surfaces using chemicals, including quaternary ammonium compounds, alcohol, chlorine, hydrogen peroxide, and peracetic acid. It's important to note that this is not an all-inclusive list of products. There are many more EPA-registered products that are designed for a specific purpose. Typically, we can achieve cleaning and disinfection by using a one-step disinfectant, which is meant to both clean and disinfect in a single application. We can use a one-step product for environmental cleaning, except on spills of blood or body fluids. This image is a great example of where it would be appropriate to use a one-step disinfectant. It's also important to note that some disinfectants are strong enough to kill bacterial spores. Bacterial spores are harmful, tough forms of bacteria that can survive for a very long time on surfaces and are very difficult to kill. A common instance of bacterial spores in the healthcare setting is C. diff. These spores can only be killed with strong disinfectants. It's important to always check the disinfectant label to ensure that the product you're using is effective against the particular germ you are dealing with, such as C. diff. Disinfection is achieved through the use of chemical disinfectants. There are two levels: high-level and low-level disinfectants. High-level disinfectants completely eliminates all microorganisms except for small numbers of bacterial spores. High-level disinfectants should be used on objects that make contact with mucous membranes or non-intact skin, for example, endoscopes. Low-level disinfectants kill most vegetative bacteria, some viruses, and some fungi, but cannot be relied on to kill mycobacteria or bacterial spores. A low-level disinfectant should be used on objects that come in contact with skin and not the mucous membrane. A low-level disinfectant can be applied to environmental surfaces and patient equipment such as blood pressure cuffs, pulse oximeters, and bedpans. Low and high-level disinfectants can be identified by the active ingredients that are found in the product. While you may not need to be familiar with the chemicals, it is important to understand the differences between the two levels of disinfectants and what the product can be safely used on. It's recommended that you follow your facility guidelines when selecting a disinfectant. Before using a disinfectant, we want to make sure we are using products that are registered with the Environmental Protection Agency, known as the EPA. But why is it important for a product to be EPA registered? The EPA registration indicates that the disinfectant complies with regulations and standards set forth by the EPA. This oversight helps maintain consistency in product quality and ensures that the disinfectant meets specific requirements related to its use, labeling, safety, and storage. The EPA registration also provides efficacy and safety assurance. This means that the EPA has reviewed and evaluated the product's effectiveness and safety details. This process ensures that the product is able to kill the germs it claims to target and that it does so without posing risk to human health or the environment when it is used as directed. Last, the EPA ensures that the product has clear and accurate information on its label, including instructions for proper usage, application, and safety precautions. This information helps people understand how to use the product effectively and safely. Let's take a closer look at the other important components of the disinfectant label. Here are the 5 things that we want to look for on a disinfectant label. We first want to make sure that the disinfectant is an EPA registered product, as this ensures that it meets regulation standards. Next, we want to make sure that the product can be used on the surface that you intend to disinfect. Using a disinfectant on a surface that the product is not intended for can cause damage to the surface or item, which poses a risk to human and environmental health. Then, we want to make sure that we know if the disinfectant is effective at killing the germs we are wanting to eliminate. Earlier, we mentioned that certain disinfectants can kill bacterial spores, such as C. diff. The label will let us know what the disinfectant is proven to be effective against. Some products may require dilution before application. If there are dilution instructions on the label, make sure that they are followed to ensure that the product is effective. This might be done by your supervisor or manager. The last and very important piece of information to look for is the contact time, which can also be called dwell time. The contact time means the amount of time a disinfectant needs to stay wet on a surface to work properly. When you use a disinfectant to clean a surface, it needs a little while to effectively kill the germs. For example, if you are using a product that notes a contact time of 5 minutes, then the surface that the disinfectant has been applied to must remain wet for those 5 minutes in order for it to work. If you wipe away the solution too soon, or if you fan or blow on it to make it dry faster, the product will not work well enough to get rid of the germs. It's important to follow the product's instructions and recommended contact time to make sure things are thoroughly disinfected. Let's take a look at some of the cleaning and disinfection do's and don'ts. Do follow a methodical workflow to avoid missing areas and prevent spreading germs. Do follow the listed contact time. This ensures items are disinfected to keep germs from spreading. Do follow a 2-step process when cleaning spills of blood or fluids. Do not rush the process. Wait until contact time is complete before using objects or surfaces or before a new patient comes into the room. Do not wipe the surface to dry it faster. And do not blow on the surface to dry it faster. Another significant risk that we encounter in the healthcare setting is medical waste. There are two types: ordinary waste and regulated medical waste. We'll look at each category as well as discuss how to appropriately dispose of the different types of wastes. Here is an overview of ordinary and regulated medical waste. Let's look at the first column, ordinary medical waste. As defined here, it is lightly to moderately contaminated wastes that are not capable of releasing liquid or caked on blood or body fluids. This is to say that as long as the blood or body fluids can be contained, then it is considered to be ordinary medical waste. Examples include lightly to moderately used personal protective equipment, items that contain saliva, sweat, tears, or any contained urine, vomitus, or feces. These items are to be disposed of in a trash bin. In the next column, we have regulated medical waste. Regulated medical waste includes items that are capable of releasing liquid or semi-liquid blood, caked on blood, body fluids, or other potentially infectious materials. To understand what falls under this category, we need to think of containment. If an item is soaked with blood and drips onto surfaces when picked up, it poses a risk to you and others, meaning we need to safely handle and dispose of the item in a biohazard bin as a way to avoid any splashes or sprays. Objects such as needles, lancets, scalpels, and broken glass should be disposed of in a sharps container to prevent injury and possible exposure. Category A infectious waste is a classification of waste that is capable of causing permanent disability or life-threatening or fatal disease in otherwise healthy humans upon exposure to the substance. A full list of Category A substances can be found by following the CDC link included on the slide. The takeaway is that a majority of medical waste can be disposed of in a standard or regular trash bin. Sharps and any waste that cannot be contained, and waste contaminated with a Category A substance, is disposed of in a designated regulated medical waste bin. Let's take a brief look at sterile processing. What is sterile processing? It's the process of cleaning, disinfecting, sterilizing, and managing medical instruments. There are many moving parts to sterile processing, and most of it we do not see. Sterile processing departments, or a vendor if your facility outsources the work, are responsible for thoroughly cleaning and decontaminating medical instruments with special equipment and processes, inspecting them for any faults, and performing packaging, transport, and storage. How does sterile processing contribute to infection control, and why is it so important? Well, properly sterilized equipment minimizes the risk of introducing harmful microorganisms into a patient's body, reducing the likelihood of postoperative complications or infections. Sterile equipment is crucial for patient healing and recovery. Let's take a look at our key takeaways. Remember, cleaning and disinfecting surfaces are vital steps for removing harmful germs from the environment. Cleaning is always required before disinfection or sterilization. Manufacturer instructions on a disinfectant label should be followed to ensure efficacy and safety. Waste should be disposed of in a designated waste receptacle. And, as with any infection control action, follow your facility's requirements and policies. You can keep exploring these topics on your own using the resources on this slide. Project FirstLine has a suite of products to help you learn more about how to recognize infection risks at work, where germs live in healthcare, and how germs spread. You can also follow Project FirstLine on social media. Thank you.